So, hi, Mary. Thank you so much for coming onto the podcast.
Thank you for having me, Tasha.
You and I connected via social media as you are quite active on a few platforms, including Instagram and Twitter. But before we get into our conversation, may I ask how you are doing now? Because I know you've been recovering from presumably COVID-19 symptoms. Are you okay now? You're well?
I'm a lot better now. Yes. It was just literally just before lockdown, I started to get symptoms. Started off with a headache, and I had a temperature for about 4 days as well. And then I think after those 4 days, I started to get the cough, and the breathlessness started to set in, and just general fatigue, really, and not being able to get out of bed, and having to be waited on literally hand and foot by my family. And it went on for about 4 weeks. It was terrible. I mean, I even had the loss of smell and taste, which was so freaky. It really freaked me out, that part. Not so much the loss of taste, but the loss of smell, which I'd never experienced before, was just very odd.
And that must have been really strange.
Yeah, it was, because I could smell nothing. And I kept testing myself, lemons, aftershave, perfume, the strongest smells I could find, vinegar, not a thing. It was so bizarre.
That
went on for a good couple of weeks. And I think at that time, there was stuff on Twitter that was coming out about loss of smell and loss of taste.
Yeah.
And I thought, oh my goodness, that is what I've got. And, it must be COVID. I mean, I never was actually tested for it, because although I'm stage 4 with breast cancer, when I called 111 at the start of my symptoms, they were like, well, unless you find it very difficult to eat and drink, or you cannot breathe very well, then please stay put.
Yeah.
So in my mind, I'm thinking, I don't really want to end up in A&E on a ventilator anyway.
Yeah.
So I forced myself to eat well. And I'm very fortunate because, obviously my immediate family, my 2 girls living with us, and my husband did everything. But then I had my sisters who lived nearby as well, and they did all the shopping for me, and they made food for me, and they brought me juices and, healthy stuff. And it's the worry as well, because, it's bad enough having stage 4 cancer, but then you've got to worry about being off treatment for 4 weeks, which I was. And then, the anxiety rising. And I must admit, I had a few meltdowns. I'm normally quite resilient and quite strong mentally, but there were days when I just couldn't hide my feelings and my emotions, even from my family, which I don't want to upset them. So it was just like an insurmountable mountain, I think. I sort of kept thinking, is there light at the end of this tunnel? Because, at that moment in time, I was more frightened about getting COVID and having to go into hospital, with the symptoms that were not getting it. I did have it, but just getting it bad enough to, make me go into hospital. But I just thought, I can't end up in hospital. No way.
So you gradually got better, probably within the latter part of the 4 weeks. Would that be right?
Definitely. Yeah. Right. Around sort of like week 3, there were some improvements, but the coughing was so persistent and the breathlessness.
And how about the fatigue? Because I know people who've had it and, like you, they didn't go into hospital, but the main thing that they had was not only the loss of sense of smell and taste, but also the fatigue. They were absolutely, completely and utterly flawed.
Absolutely flawed. I had that as well. Right. Literally, I couldn't even feel my legs. I felt that weak as a kitten, literally. It was awful. And and one day you'd feel sort of like a little bit better, and the next day you'd go right down again.
Right.
And the fatigue was just the exhaustion. It was just awful. And I'm a personal trainer and a pilates instructor, and I was absolutely floored by it. It was very bizarre.
God. Well, I am so glad that you have recovered from this awful virus, and for you to be able to recount this story. You mentioned earlier that you're currently living with secondary or metastatic or stage 4 breast cancer,
Yeah.
and had been receiving treatment. So obviously when the lockdown happened, how was your treatment affected, if at all?
Well, I had an enforced break. I would have actually been okay with treatment continuing.
Okay.
Had it not been for the fact that I had COVID
Right.
symptoms, because obviously my immune system was already compromised. So the COVID in the mix just would have made it too dangerous for me to have my chemotherapy. So I had an enforced break, and I still had, I couldn't even have a blood test in that time either, because the hospital were like, no, you can't come in.
Yeah.
And they wouldn't come out to me. So I didn't know at the time what was happening. Was the disease progressing? What would happen to my markers? Would they go up? So I still had consultations over the phone with my oncologist.
That's good.
So I still had that, connection. But he wouldn't. It was just he did all phone stuff, and he still is doing phone stuff. He doesn't actually have face-to-face contact with anybody at the moment.
Yeah.
And I can understand, because, the last thing they would need on an oncology ward is somebody coming in with COVID-19 symptoms. So
Exactly.
I was very understanding, and I knew that that's what I had to do. But unfortunately, we're not absolutely sure whether it's the enforced treatment break or if it's coincidental. But when I started having blood tests after the symptoms lessened, my markers went up, and they've gone up for the last 4 blood tests, because I have blood tests every 3 weeks.
Right.
And they've been going up quite considerably. And it was a case of like, is it the inflammation that's making them go up from the COVID? Or is it the capecitabine, the oral chemo that I was on, that has stopped working? So we had to wait a while to see whether these things were going to level out, or whether it was just going to continue to rise. I mean, even if they'd stayed stable with the markers, then we might have assumed, yes, it was the COVID, they'll start going down again. But I think after the 4th blood test, the 3rd and 4th, my oncologist was very convinced that the capecitabine wasn't working for me anymore. And yeah, so I've had to come off of it.
We will definitely talk about where you are currently, because things have changed a little bit since all of this has happened, since the COVID lockdown for you has happened. But before we go there, could you just describe, first of all, when and how old you were when you were diagnosed with your primary breast cancer?
So I was 41 years old, just literally, when I was first diagnosed, it was literally a couple of weeks before my 42nd birthday. And I was always a self-checker. I'd check my breasts, regularly in the shower, whenever I got the chance, really, and I remembered. And I found a pea-sized lump behind my right nipple.
Right.
And so I deliberated over this pea-sized lump for a few weeks. And then my husband was like, just for goodness sake, just go to the doctors and just get yourself checked out and whatever. So to cut a long story short, I went to the One Stop Breast Clinic. I went on my own, thinking that I only had a fibroid, as my GP had told me. Don't worry, it's probably just a fibroid. We'll just get you checked out. So off I went on my own. Even my husband was like, "You're going to be fine. You don't need me." And I had a barrage of tests, one after the other. And it was really unsettling, because I went in with a load of other ladies sitting there. By the time I'd left, after the 2.5 hours I was there, I was, I think, the last one there. And that made me think, hang on a minute, where is everyone else? But I'd had all the tests. I had the aspiration, the mammogram, the biopsy, the ultrasound. I had it all in those 2.5 hours. And yeah, so it was really quite stressful. And in my mind, I kept thinking, this isn't right. I know something's not right. And I tried to leave the car park. I actually crashed into somebody's brand new Golf.
No.
Right. And the young man was actually sitting in it, waiting to reverse out of the car park as well. But he was so lovely. He was like, don't worry, there's not much damage to the cars.
Oh,
Shall I
that's
take
sweet.
you back into the hospital? We'll get you a cup of tea. I said, oh my God, I just need to get home. So I just then got back into the car and just phoned my husband, and I was like, you told me I'd be okay.
Yeah.
And it's not okay. So I was very, very upset, obviously.
Of course.
A week later, I got the results and it was confirmed that I had breast cancer. And, it's like everyone says it's just a bombshell. You just don't expect those words you don't expect to hear those words. And I just sat there and I just couldn't hear anything. I think I was just completely in a bubble, and all I could hear was echoing voices. And the nurse sort of like came up to me with a box of tissues, and I started crying. And yeah, it was just an awful time, that diagnosis, and even after the diagnosis, when you go back home and you've got to tell your family, you've got to tell your parents and your children, and it's just awful. And it's just,
it's
really
it's very hard, isn't it?
It's so difficult. It's just the hardest thing was having to tell my children and trying to keep it together.
How old were they at that time?
So Robert was 14, and the twin girls, they were just about to start year 6 in primary school.
Okay, quite
so
young.
They were sort of like 10, 9, 10, whatever they were. So they're quite young, and we made the decision to not actually tell the girls at first. So we told Robert because he was older, and we thought he's going to take it a little bit better. And I think I just felt different telling him. Whereas with the girls, because they're not that Robert isn't attached to me, because of course he is, but the girls are very, very attached to me.
Yes.
And I knew that I would find it very difficult to tell them without breaking down. So we didn't actually tell them at the beginning. But the girls, being the girls, they're quite shrewd and quite perceptive. And they actually found out by looking at one of my emails.
Really?
Because they could sense that something was wrong. And now if anybody asks me, should I tell my children, I'm always like, yes, absolutely.
Yes.
Because, depending on their age, you can tell them in certain ways, but definitely tell them, because if they start to worry in their own little world and then they suddenly find out from an email or a text or something, because that's not very nice.
Yeah.
And I do regret not telling them from the start.
Yes. I mean, telling your family, especially young kids, is just really, really hard. And I think I agree with you. I do tell my patients who ask me that question, I think the best way to do it would be to tell them, because of the reasons that you've said.
Definitely. Or even get someone else to tell them, a close family member. If you can't do it, then, get someone else to tell them.
Yeah, because children are very perceptive, and they can sense when something isn't quite right, can't they?
Exactly. So I've learned that. I learned that. But I suppose because I was diagnosed almost 13 years ago with primary breast cancer. So although the nurses, my breast care nurses, were really helpful, and, you got sort of like so much information thrown at you, all these leaflets literally were coming at you from all directions.
Yeah.
And I didn't really read everything. And I think mostly because I was just too frightened to read stuff and to Google stuff and whatever. But now, even today, we've moved on so much, and there's like, you can get counselling for your children if you need to. You can get someone else to speak to them. Even your GP could speak to them. But then 13 years ago, we didn't have as much as that. So it was quite difficult. But my advice now would be, please tell your children in one way or another.
Yeah.
Buy a book. There are lots of books out there that you can give them.
No, there are lots of books and resources out there, and as you said, people are becoming more open to opening up to their children about cancer diagnosis.
Yeah, exactly.
And it's never going to be an easy conversation, but it's something that has to be done at some point, I think. So you had surgery.
I had a choice whether to have the mastectomy or the chemotherapy first, and I went for the mastectomy. So that was the first thing that I had done.
Okay.
Was a radical right side mastectomy. I had a full axillary clearance. So all my lymph nodes were taken out, even though none of them were affected. But the surgeon was very much like, you're very young. Let's give you the best possible chance. Let's take them all out. Had the mastectomy, no reconstruction. I just wanted to get back to work, Tasha.
Yeah.
That's all I kept thinking about. I've got a duty of care to my clients. I've got to get back to work. What's the quickest route there?
Yeah.
So I had no reconstruction, and I don't mind saying I'm not large chested. I've got quite small breasts.
Yes.
I thought, you know what? It's not going to really make much difference. I've got a very supportive and loving husband. Who cares? Who's going to care,
Yeah.
So, and I had, I just went with the mastectomy first of all. I came out on the day of my birthday.
Oh,
on
God.
my 42nd birthday, that was the day that I left hospital. I was so thin, I'd lost so much weight from the stress and the worry. And I ate cake.
God, I am glad you did, because what a birthday day that was.
Oh gosh, yeah, with my 2 drains,
Oh,
my new
goodness.
accessories. I just sat and ate cake and had cups of tea. My family made sure that I had a really good birthday.
Yeah.
So it was quite difficult because having all my lymph nodes taken out, I couldn't even lift my arm off the bed when I came round from the operation.
Really?
Oh my God, it was just so scary. I thought, my God, what have they done to me?
Gosh.
But obviously the exercises, determination, whatever. I've got full range of movement in my shoulder. I still have the feeling of numbness.
Which is probably a permanent thing, isn't it now?
Yeah, that's there all the time. It's like I've got a newspaper folded under my arm continuously. It's like there's a tightness there as well. That it's just all, it's odd.
Yeah.
I don't sweat from that armpit.
Right.
So I save quite a bit on deodorants.
By 50%.
By 50%, Tasha. They last me an age.
Silver lining, right?
Exactly. You've got to look for the good in all these situations. Honestly, you've got to have a laugh about it as well. So I had the mastectomy, and then I had 6 months of intense chemotherapy.
Right.
Straight after that. Well, a month. I had to wait a month.
And how did you cope with your chemotherapy?
Gosh, it was tough.
Was it?
There was a cumulative effect. So I had FEC, FEC, for the first 4, and then I had docetaxel, the red one, for the last 4. And the docetaxel really just
floored you.
Yeah, it was just like, not very nice. I had lots of side effects. It affected all my nails, all my toenails, my fingernails. My hair fell out, obviously. I got the nausea, all of that. The sore mouth, the taste, the difference in taste. The palate changes quite considerably, and also very, very sensitive to smells. It's a bit like being pregnant,
right?
But on almost like a much larger scale, when you've got all those like weird cravings and things and whatever. So at times I felt like I had 2 heads, but you get into a little bit of like a pattern, because I was having it every 3 weeks, the chemo. So I knew that week 1 I would feel horrendous, but then weeks 2 and 3 start to sort of feel a little bit better, and that's when I'd go out and do exercise and meet up with friends and just try and get some sort of like normality back into my life. I did give up work though during chemotherapy, because I thought it wouldn't be fair on my clients if I was like coming and going and
Yes.
Sorry, I can't come out to you today because I don't feel very well, or I'm just, I'm being sick down the loo. Sorry, I can't come to you. So I thought, you know what? I'm just going to just give it a break, give myself a break, and then really concentrate on my own fitness levels.
Yes.
And lots of self-care, and then going back to my clients.
Yes, because at this moment in your life, you were a personal trainer and you had your own business.
Yeah.
So you're having to keep your clients to one side until you recovered from your own illness.
Exactly. And that was also quite a big decision to make financially. I'm not going to lie, we struggled without me working. And also because I'd built that business up from scratch.
Yes.
That was heartbreaking.
That's your baby, right?
My baby. And, I'd built up a reputation. I was teaching classes, in church halls and at different venues. I was teaching kids fitness in schools. And I had lots of PT clients. So to just suddenly just shelve all of that and say, sorry, I can't help you right now, I have to look after myself, was actually it was quite hard.
Yeah.
Because that's not me. I'm helping others most of the time.
Yeah. But that's the best. That's the best decision, really, isn't it? Because you can't help others if you're not well.
Exactly. But I must mention the middle sister, because there are 3 sisters. There are 3 of us. I'm the oldest. And my middle sister lived in the States at the time. And bless her, she did come over after my operation.
Wow.
And almost was just there at my side,
so lovely.
nursing me and helping me get dressed and helping me to have showers. Very, very difficult negotiating 2 drains.
Yes.
And dressing and showering, and with the dressings in place, it was quite difficult as well.
And it's quite stressful because, you worry that the drains are sometimes they're quite precarious to move about, and you worry that you're going to pull it out, and it can be quite uncomfortable sometimes, and you're having, to carry around these drains, these little plastic bottles in these bags. Yeah, it is very cumbersome, isn't it?
It's horrible when you've got to think, when you get little bags for them now to cover everything up, but it's not very nice.
It's not very nice.
That what's going in there.
Just don't look at all the stuff that's in those bottles. So.
Yeah, but so my sister helped me out quite a lot, and then my little sister was so good as well, because after my middle sister went back to the States, after 3 weeks, my little sister was there on hand,
right?
Looking after me as well. So, but I'm very lucky to have them close by. Well, now the middle one has moved back to the UK, so they're both close by now. They're both
that's
close
brilliant.
by. Yeah, exactly.
It's nice to have family close by, especially family members who you get on with, of course.
Definitely, most definitely. Yeah, so I actually ended up having about a year off work.
Yeah.
A year to a year and a half. I had a couple of really lovely holidays after treatment ended in the March of 2008. I had a nice couple of, summer holidays, which was very
lovely.
Nice. And then that's when I thought, okay, I'm going to do Pilates now.
Right. Okay. So that is what sparked you to start your Pilates, because before that you were a personal trainer.
Yeah, exactly.
Okay. Right.
So I just thought, and I didn't know anything about Pilates actually. It was my sister who lived in the States who introduced me to it. And I just started loving, the concept. And it was such a difference to what I was doing with my clients, which was all about getting hot and sweaty, getting your heart rate up. Whereas Pilates was almost like the complete opposite in a way, where it was very much like a mind body.
Yes.
Well, it is a mind body.
It's like yoga and strength, isn't it?
Exactly.
Combined.
Very much with the focus on your core strength, which in turn helps your back. And that's why it's so beneficial for people with postural problems, and in particular with back problems. So I just fell in love with it. And now the Pilates really makes my PT work a lot better actually for my clients, because they get the best of both worlds. And I incorporate a lot of the Pilates into the PT. And I think, knowing about your course, about your core and how the core works and its functionality, and it's just amazing. It's just, it's brilliant.
I remember the first time I ever did Pilates, and I really struggled and suffered through that class. And I remember walking back home, and the next day, seriously, I think I was aching in muscle areas that I didn't know existed. It was really, it was to me at that time, because clearly my core strength was poor. But since then, I love Pilates, and I think core strength is something that we neglect. And until you do Pilates, you don't really realize how important your core strength is.
Exactly. It's like, it's so underestimated. And so it's just, and I wish I discovered it sooner, a lot sooner, because it postural wise, it would have really helped me. Not that my posture's that bad, and I think with the years of practice, it's improved quite a lot. But it is something that I think everyone should know where their core is. I mean, even now when I have to do my beginner courses, and I always ask the question, does anybody know where their core muscles are? And I can, you can bet your bottom dollar that people don't know where it is, what it does, what the functions are, how it's all connected. And people are just amazed by it. It's just, and I think if you can just stick it out and you can learn the mechanics of it and the dynamics of it and what it can actually do for your health and your well-being, but people don't always stick it out.
Okay.
They might do the first 1 or 2 sessions, and then they're like, "Oh, what am I doing?" And I don't get the breath work.
Yes, because it's not like aerobic exercise, is it? It's more anaerobic
coordination,
exercise.
And it's all about really quietening your mind. And people have a misconception about it because they think it's just for women, normally for older women. And that it doesn't really work your body. But what in actual fact it does, it's just very intense. The movements are slow, they're controlled, but it's the intensity,
Yeah.
But I do have a really good following, and I love seeing the same people come back week after week and just telling me how their hip problems been remedied, or their posture's a lot better, or their back problems have been almost, they've been almost cured of them and avoided surgery and stuff like that. And that's the job satisfaction that I get, that I really enjoy.
No, that sounds amazing. So how do you think Pilates impacted your recovery?
Wow. Oh, immensely. It was a huge benefit to me, and I'm so glad that I discovered it when I did. And I don't know, and I owe my sister, for actually introducing me to it and telling me how great it was, because she was doing it in the States, like 3-4 times a week. I'm telling you, Tasha, she came back with a washboard stomach. And I think in about a year, because we sort of like, she came and visited like annually.
It's amazing.
And we saw her from one year to the next, and I was like, "Whoa, what have you done? What have you been doing?" And she was like, "Well, it's this thing called Pilates," and I thought, "Okay, I need to get onto that."
Yeah.
And because I was before I had the operation and afterwards, it is very much. It's just like physiotherapy. It's all wrapped into that one little thing. Physiotherapy is very much Pilates, but without the breath work.
Right.
So for me, it was like it was a bonus, and it really helped my recovery immensely. I got my arm functioning really well, really quickly as well. And I put that down to Pilates, and also for my mental health as well.
Yes.
It really helped because it can be quite relaxing as well as intense. For me, it was just eye-opening. It was almost like revolutionary, really. And it really helped me in my recovery, which was the most important thing for me. And then I could just pass on my knowledge and my skills, to other people.
So you continued your recovery. Obviously, you started your to become a Pilates instructor as well as a personal trainer, and everything was fine. And then what happened in 2014?
Yes, so I was on tamoxifen for 5 years after the treatment had ended, after the chemo had ended.
Right.
So my oncologist actually wanted me to stay on it for 10 years. But I said no. I thought, no, I want to have my life back again.
Yes.
I've been cancer free for 5 years, and I thought 5 more years. I just thought, gosh, because I was getting really quite frequent headaches with it as well.
So it affected you quite badly.
It affected me. I got the brain fog was intense on some days, and I did have like some joint pain as well. So in the mornings I'd get up and feel quite stiff. So I said no. I said, look, you've given me the choice. Can I take a break from it? He said, okay, have a break. So I was off tamoxifen for a year and a bit, and I felt so good. I felt so good again.
Yeah.
Not having those joint pains in the morning, just being free of those headaches. It felt amazing.
Yeah.
But then, and I was still having all my checkups with my oncologist. I was never discharged. And then in a routine examination, he found a lump behind my collarbone.
Okay.
Again, a pea-sized lump, which I would never have found it. I would never have. Although because he looked after me quite well, so he always, checked me over around my neck, collarbone area, armpits, and everywhere. But I never really checked myself because I was seeing him regularly. I never really checked those areas myself. But he was one that found it in a sort of like routine checkup. And then it all just, so it was basically, although I had all my lymph nodes taken out, it was what they call it the mammary chain.
Yes.
So after a PET scan, they found more lymph nodes in my chest wall.
Okay.
That were affected. So then I had radiotherapy, which I didn't have in the beginning because they thought that might be overkill.
Yes.
I had 25 fractions of radiotherapy, and I also had, I like saying this word, an oophorectomy.
Okay.
So I had my ovaries and fallopian tubes removed as well, because I thought, my cancer's estrogen receptive. I was having also, I started having the Zoladex injections as well.
Okay.
To shut down the ovaries. But then I had a few months of that, and then I thought, well, I've got my children. I don't really need my ovaries, so let's take them out.
Yeah.
So I had that came after the radiotherapy. It started getting intense now, because now I was diagnosed.
And were you restarted on any tablets?
So yes, I went on to Letrozole.
Okay.
So Letrozole was not kind to me.
Okay.
Letrozole ruined my knees and my ankles to the point where I couldn't even run.
Yeah.
It was like my knees were locked, and I'd end up hobbling after a few minutes of running.
Right.
And that was impacting my job. So I could sort of like walk, but even walking after a while would, the pain would set in, and it was just horrible. It was just literally like they were just locking. Right. Couldn't run at all. Literally ended up, it's horrible. Anyway, it was horrible. So I went back to my oncologist and I said, look, I can't really do this. Is there an alternative? And he put me on anastrozole, which he said it's the same, but it's slightly different. And that was just fine. That I did not have those pains anymore. I could go back to doing my full workouts and running with my clients and running for myself. So that was it was just such a relief for me. So then I was on anastrozole, and things were sort of like stable for a while.
Yeah.
Because I was actually cancer free for 7 years.
Yes.
And then I was diagnosed with secondary. I knew it was incurable. But I had to, I was having regular checkups all the time now. I was being seen, I think, every 4 months by my oncologist. Right. Blood tests, every 4 months as well. But I was still working. Right. The business was going well again. I'd, built it all up. And even during the radiotherapy, I still worked during that. And after my oophorectomy, I had a few days off and then I went back to work. And, the classes, if I had to, I just taught sitting, verbally cueing, my class participants. And with the PT, if I couldn't do stuff, then I just used to just demonstrate in one way or another, or show them pictures or something. Or I just did whatever I could do.
Right.
But I was determined not to give up my business again. And so I thought, I'm just going to keep going.
So in 2014, which was 7 years after you were diagnosed with your primary breast cancer, you were told that you had secondary breast cancer. How did you digest that news?
It was, well, obviously, it was just like being diagnosed all over again, because I knew that secondary breast cancer would be life-threatening, and being one of the 30% of men and women that go on to get secondary breast cancer, that figure was just like, wow, it's like there are 70% of women and men out there that don't actually have a reoccurrence. And here I am with this, well, yeah, I mean, how do you describe it? You can describe it as a death sentence, a terminal diagnosis. I knew it was scary. I knew that it was, but I also knew that it might come back, because my oncologist did actually say to me, you have a 95% chance of being cancer free for 5 years.
Okay.
So that conversation stuck in my brain, and I kept thinking, well, what happens after 5 years? I might get a reoccurrence. My cancer was diagnosed as stage 1, but grade 3, so I knew it was aggressive. So yeah, all that information that I'd listened to at the very beginning, that stayed with me throughout even those 7 years of being cancer free.
Yeah.
And I even had counselling, like soon after my treatment ended as well, because I couldn't cope with not having treatments and things. But anyway, so yeah, just fast forwarding back to 2014 and how I felt. You just don't know. When you're diagnosed with primary, your thoughts are, am I going to be here in 6 months' time? Am I going to be here with my kids at Christmas? Will I see my kids grow up? All those thoughts are there, and those thoughts come flooding back with a secondary diagnosis, but with a vengeance, because then you've got all that other information that and then you really think, oh my goodness, is this it? Is this it? So yes,
it's difficult. I mean, did you have any, or do you have any strategies to help? Because obviously people have, good days and bad days, and we all have those. Do you have ways to cope with the difficult times?
I think that doing the job that I do has really helped me, because it's been a huge distraction, because the focus is very much on helping others. So that's my job, first and foremost, has definitely been life-saving for me.
Yeah.
So that's been a real big distraction. Again, like doing breath work has always helped me. And now it's very trendy now. Everywhere you look, everyone's doing breath work.
Yes.
I think I've been doing that for a long, long time. and just spending time with friends and family and setting goals as well, making plans. There have been times where I haven't been able to plan ahead, because once you get those PET scan results that show you have progression, then you think, okay, so now I can't plan until I get a treatment plan in place, and I know exactly how it's going to affect my time, my job, my health. You can't plan ahead.
Yes.
So I do, and there was a time, Tasha, where I wouldn't even buy myself clothes, because I thought, what's the point of spending money on myself when my family are going to have to get rid of it all, when I'm gone. It's things like that.
Yeah.
And I just thought, it's a waste of money. I don't need clothes. So I stopped buying myself things. And that was tough. But the planning ahead. When you're used to planning a holiday and you look forward to that holiday, and then that's taken away from you, that's tough. That's really tough, because you've got people around you that are like, okay, let's go here, let's do this, let's go there in next year. And in your mind, you're thinking, I might not be here. So that's really hard. But I do actually now, I do make plans. And that's one thing that's changed over the years.
Right.
Is where I promise myself that I've got to make those. I make even just short-term plans. I make them. And it's finding that balance between, spending time with others and then spending some time to yourself as well, for yourself, getting into almost like the holistic self-care as well.
Yes.
Learning to meditate, even if it's for 5 minutes a day. And I do actually do yoga as well. I don't teach yoga, but I go to classes, and I have lots of friends who do yoga, and the colleague who I do the retreat with, she's obviously a yoga teacher. So, I see her and other yoga teachers, but it's just such a lovely combination, yoga and Pilates. It's great. So I have slowed down a lot as well.
So that was, I'm just trying to think now, 2014, you were given the diagnosis, or you were told you had secondary breast cancer. Were you fine all that time, or did another event happen?
Yeah, so I was stable for a while on the anastrozole, and then it was so I'm trying to remember the dates now, because I've been on so many treatments and had all these things done. Yeah, because I remember now, I had the lymph node that was behind my collarbone. I had that removed as well.
Okay, so you had surgery for that.
So I had surgery for that. But the lymph nodes in my chest, they were like, no, we won't touch those, because that is a big operation.
Okay.
And it would have meant, sort of like breaking the ribs.
Yes.
Going behind them. And my oncologist kept saying, once we get in there, I don't want to scare you, but I don't know we don't know what we're going to find, what the surgeon's going to find. And it might make it an even bigger operation. So we decided to leave those.
Okay.
So I was on an anastrozole, and then I was on an anastrozole for, I think it was a couple of years. And it was in 2017, I believe, that a PET scan showed progression, and I now had it in the liver and in like my bones as well.
Okay.
So, and there were a few suspicious bits and bobs in my lungs as well.
So the disease had progressed.
Yeah, it had progressed. And then it was a case of just, oh God, then I was on exemestane, everolimus. I was on like lots of different bits and pieces. And it was really 2018, 2019, which were really quite significant for me, because I had so many different treatments. I thought I almost lost track, but nothing was working.
Did you have any symptoms?
No, I didn't. And I think that for me, that's a good thing, because I hear a lot of people that have pain and have to have pain management and whatever. And I will go on to sort of like, update this conversation. But, I didn't really need any of that.
Okay.
But then I had liver ablation. I had RFA, radio frequency ablation to the liver, to kill off the tumours there. I had 2 tumours, and that worked really well. And then I had cyberknife as well on my sacrum, because that's where it initially was, in my liver and in my sacrum. That was the progression at the time. And so the cyberknife worked really well on my sacrum, and the RFA, the ablation, worked well as well on my liver. So then that was in the January of 2018. And then, towards the end of that year, and then 2019 as well, which was all a bit of a blur, because I was on different treatments. And then I had, towards the end of 2019, I was on fulvestrant and palbociclib.
Gosh, you were on a lot of different drugs, weren't you? No wonder, not surprised there's a bit of a blur.
Yeah, in fact, you know what, Tasha, I'm just thinking now, the ablation and the cyberknife was at the beginning of 2019.
So beginning of last year?
Yes,
okay.
That's right. And then I was stable for a while. Then in the summer, yes, great, everything's working really well. The markers have gone down, this and that and the other. But then it was in the late summer of 2019 that I started getting more progression. And I was put onto fulvestrant and palbociclib then.
Okay.
So palbociclib destroyed my white blood cells. My neutrophils were just literally nothing. I had no immune system whatsoever. And we continued with just the fulvestrant, which are those. Do you know those lovely big bottom injections?
Yes.
Wow.
Yes.
I'll leave it there. So we continued with those because they're the hormone therapy side, but that didn't work.
Okay.
Because the plan was to allow my neutrophils to sort of like rise again, and then get me back onto the palbociclib, but my body just couldn't take it.
Right.
It just wouldn't. Yeah. So, okay, let's come off of that now.
Yeah. Yeah.
Get you on something else.
You need some white cells around to fight infection.
Exactly.
Don't you?
After palbociclib and fulvestrant, I was put on paclitaxel.
Right. Okay.
So I had 9 weeks of weekly paclitaxel.
God.
My hair fell out again for the second time. I lost everything, all eyebrows, eyelashes, everything. That was tough. People say to you, but it's only hair. I know it's only hair, but 2 years before that, I'd actually stopped dyeing my hair as well.
Right.
So I'd grown my hair out. I had just grey, hair, grey salt and pepper hair, and I'd grown it to a really nice length. And I loved my hair, Tasha.
You lost it all again.
And I lost it all. So it was a really big thing for me to stop dyeing my hair as well.
Yeah.
And to go through that, growing out process. But then I'd not had a longer hairstyle in quite a while. So to have it long again was lovely. But anyway, so I lost everything. And paclitaxel did nothing.
Okay.
Did nothing at all to help me. So that was a real blow, because I'd gone through all of this and it hadn't worked.
And then you went on capecitabine after that.
Yes, that's it. So now I'm at the point of having PET scans every 3 months, and I had more progression in the liver and a bit more progression in the bones. So capecitabine, it kept me stable for a few months. I don't know, 3 months, whatever. And then I had a pet. So where are we now? We're in June, aren't we now?
Yeah.
June. So
the recent developments is in and around COVID time now.
Yeah. So now we're sort of like, we're just about to, because I had my PET scan in January, which showed me stable at that time. So I had a little bit of like, great, some stability. Cape's working a little bit, nothing really too, major, but it was working. But then COVID came along. And so then I had to come off treatment. And my latest PET scan, which was last Tuesday, showed further progression. So it's now in my ribs, my pelvis, and my spine. There are quite a few, but it's quite widespread.
Gosh, I'm so sorry, Mary.
Cervical, thoraco, lumbar, spine, which means up and down my spine, basically. So it's really quite, I don't know how bad it is in my spine, but the liver has also got more progression, and that's quite intense in my liver. So, and also in the time that I've been off treatment, and I have been feeling a few twinges here and there, because it's funny, because sometimes cancer pain comes and goes, doesn't it?
Yes.
And I didn't know that, but then I kept thinking, well, it's okay, because whatever that pain was I was having, it's gone. But then it might come back, a bit later.
And where were you getting these niggly pains? In
the niggling, the waves of pain. I had one weekend, a couple of weekends ago, where I got like waves of like in my right hand side, which made me think, is that my liver, or is it stress, or is it anxiety? And also, what I have to deal with is, because of my work, I do get pains and aches and pains.
Yeah.
From different exercises, or I might get DOMS, delayed onset of muscle soreness, or so I have to try and somehow decipher what's what. Do I tell my oncologist about this pain? Do I wait? Would it go? So there is progression. I had that news last week, and it worries me. What worries me now is how it's going to affect my work.
Yeah.
And can I still do high impact exercise, or am I at risk of fractures and things like that? So it's in my ribs as well. It was in my ribs before, but it's progressed. So yeah, it's widespread. It's low volume, widespread in most areas, but the liver, I think, is the main concern, although my liver function is still good.
Okay, well, that's encouraging, isn't it? That's encouraging.
So that's good.
So that you've had a change of treatment then, I'm assuming.
So yesterday I had my first dose of eribulin, intravenous eribulin.
Okay, so they've stopped capecitabine.
Capecitabine stopped, and thank goodness I didn't have to have a washout period.
Yeah.
We got the drugs approved straight away, and I started it yesterday. So I had my PET scan last Tuesday, got the results. No, I had it last Wednesday, my PET scan. Got my results the following day, on the Thursday. Had my blood test on Monday, just gone, and started my chemotherapy yesterday. So it's all gone, thank goodness, because I thought, if he tells me that I've got to have a month of washing out, that is going to take my anxiety to another level.
Yeah.
So I just, thank goodness, he was like, we can get you on it straight away.
That's really good. So how often are you going to get this, and for how long? Do you know?
So, yeah, well, for as long as it works, I think. Because this is the thing now. Every treatment I've had, I've never had an end date. It's always been, you're on it for as long as it works. So that's the way the cookie crumbles now.
Yeah.
I'm on treatment for life, and it's just a case of, and that's why I just want stability. I want a reprieve. I've had a year and a half of progression, and I need I need something to hold on to, and I just keep hoping and praying that, the next treatment is the right one. And the thought of exhausting my options is really scary.
Yes.
Because the longer I'm living, the scarier it gets. I'm already beating the odds. The median is 2 to 3 years after a secondary diagnosis, or it could be 2 to 5 now, I'm not sure. But I'm beyond that. It will be 6 years for me in August. So, yeah, I just there's got to be something out there that's going to work, and it's got to be with this one.
Yeah, fingers crossed, Mary. Fingers crossed. Yeah.
Cape Cytobin was supposed to be my Cape Crusader.
That's it.
It let me down.
Well, let's hope Eribulin will work this time.
Exactly.
I'm sorry to hear about the disease progression, and it's just having had this conversation with you, it's so obvious that you are a positive type of person who always tries to look at the positive side of things. And for some, this is is an example, I guess, of how you can cope with really difficult circumstances, because living with secondary breast cancer must be really tough.
Yeah, you have highs and lows. It's just an we use the term quite a lot. It's an emotional roller coaster. You're constantly coping with emotions and feelings. One day you're up, the next day you're down. You're dealing with the physical side of things as well, and you're also dealing with constantly trying to protect your family. And that I do that part I struggle with quite a lot, because I don't want to upset my family with my bad news all the time. And we've had so many setbacks in the last few years, and that's hard, because you're constantly going back and having to tell people the news. And of course, every setback you have, you think, well, is this it? Is this is this the final bit of news that I'm going to get? And that is tough. That is really, really hard. That's why distraction is absolutely paramount. If you can cope with being left alone with all of that going on, that's fine. You need some sort of like time to yourself. But otherwise, just spend time with family, friends, enjoy your life as much as possible, make every day count.
Yes.
And, set yourself little goals, make those plans. Just keep smiling, because the world smiles back at you if you keep smiling.
Yes. No,
keep exercising. Yeah. I mean, it's just, it's tough. It really is tough. I'm not going to lie.
I mean, you're active on social media, Twitter,
that
Instagram.
helps as well.
Yeah, I was just wondering, do you think, because you share your stories, you spread positivity, you inspire people. Why do you think sharing stories is so important? And do you think you've benefited from that?
Well, I think initially, because I started working with charities. I've done quite a lot of work with the charities as well. So I do quite a lot of, raising awareness and raising funds for the charities. And initially, when I started working with them, sharing my story was to help others, to sort of like make people understand actually having cancer didn't have to be the be all and end all, and it wasn't perhaps the death sentence that people thought it might be. So I just felt like sharing my story was just helping others, and I think it's just I've always had that thing in me about helping others.
Yes,
and I've always had the thing in my head where everything happens for a reason, and every adversity, you can find that silver lining, you can find the good, and that's what I did. I just turned my misfortune into something positive, and I might have not done half of the things that I've done since being diagnosed. Had I just been carrying on, with my life as it was before my diagnosis, I don't know. But sharing my story has become, for me, very cathartic. So I feel like I'm helping others, but then it's helping me as well.
Yes.
So, I write my blogs and share my story because it helps me as well. And, I'd love to write a book.
Oh, do
one day. And, in my mind, I'm thinking, God, is it just imposter syndrome? Am I good enough to write a book? But I'd love to write a book. And there have been people that have written books from their experience, and I'd like to do that too. And I think it would be like a really nice legacy to leave behind as well.
Thank you so much for sharing your story with me and the listeners today.
Oh, it's been my pleasure.
And please do write that book, because I think it will help many, many people who are in similar situation as you, and I'm sure they'll derive a lot of comfort and inspiration from it. So definitely write that book.
Thank you so much. And I feel, should I have been calling you Dr. Tasha?
Oh, should you be calling me Dr. Tasha?
Yeah.
No, just call me Tasha.
I've been calling you Tasha, and I think, oh God, is that just being disrespectful to Dr. Tasha?
Honestly,
because she's got such an important job.
No, oh my Lord, please call me Tasha. That's my name.
Oh,
yeah,
it's been such a lovely conversation with you.
No, honestly,
today.
Thank you so much for coming on. And if people want to connect with you, where would they go? Where should they go?
So my website is www.breakthroughfitness.co.uk. So Breakthrough Fitness is all one word, .co.uk. That's my website.
Okay.
So my Twitter handle is @Mary_Huckle. My Instagram is just Mary Huckle.
Okay.
You'll find me quite easily on there. And then on Facebook, I am just @Mary Huckle.
Great. So that's Huckle, Huckle.
Kle. That's correct. I have got a Facebook page for Breakthrough Fitness as well. And that's just @BreakthroughFitness1, I think it is.
Great. I will leave all of these in the show notes for this episode. And, people, please connect with Mary and send some love and connect with each other. So
thank you so much, Tasha, for asking me to come on today.
Thank you for coming.
That's my pleasure as well.
All right. Thanks so much, Mary. Well, there you have it. Thank you so much once again to Mary Huckle for coming onto the podcast and for being an amazing guest. For those who haven't connected with Mary on social, I would definitely recommend you do so. You can connect with Mary on Twitter @Mary_Huckle and on Instagram and Facebook @Mary Huckle. And her website is breakthroughfitness.co.uk. And I will leave all of these links in the show notes at mybreastmyhealth.com/episode 18. So I've been really enjoying producing these episodes and having amazing conversations with so many amazing people. And the problem is with podcasts, though, is I don't hear back from you guys. And so what I would really appreciate, if you have a few minutes to spare, would be to leave a rating and review on Apple Podcast. And that would really help me out, because it will help the show to get more discovered by people, and hopefully it will help more people at the same time. And also you can connect with me on social media as well. You can find me on Twitter and on Instagram at Dr. Tasha G. So that's Dr. Tasha G.